this. Okay. This presentation, the topic of today is let's talk about commercial tobacco and vaping. This presentation will cover the changing landscape of commercial tobacco and raise of vaping amongst youth includes what are the devices and products, what are the health effects. Pat McKone, Senior Director, Public Policy and Advocacy of the American Lung Association, has worked with the lung health programming for over 45 years. Ms. McKone's work has included tobacco cessation programs for adults and youth, limiting youth access to tobacco, public and school-based education, raising awareness of the impact of tobacco in those with mental illness and or substance abuse disorders, as well as advocacy around limiting exposure to secondhand smoke, smoke-free housing, point of sale, and e-cigarettes. Pat was instrumental in founding the Lung Mind Alliance, a statewide partnership between mental health, substance abuse, and commercial tobacco control leaders in Minnesota, working together over the past 10 years to address disparities related to commercial tobacco in these populations, and serves on the National Partnership for Behavioral Health and Tobacco Use. Ms. McKone was the 2017 recipient of the American Lung Association Distinguished Professional Service Award and was recognized as part of the Blue Cross Trailblazers Award in 2018 and was awarded the MNSOPE, you can pronounce that MNSOPHE Award for outstanding contributions to public health education in 2022. She's a senior director of public policy and advocacy at the American Lung Association. This is where she works and have worked for 45 years. She's been instrumental in her field, and now without further ado, I will turn this portion of the service, a portion of this meeting over to Pat.
Easy for you to say, Angela, right?
Yeah, I usually do introductions at church, so and I got this. I was on service.
That's great. Amen. So, so thanks for joining us. We're a small but mighty group, and I definitely want to make this as conversational as possible because I know how easy it is to multitask and kind of like, what were they talking about again? So let's have some fun at the end of the day. So I'm going to talk about vaping and the epidemic of e-cigarettes. I work for the American Lung Association. We are the oldest voluntary health organization dedicated to lung health in the country. And when I talk about tobacco today, I am not talking about sacred ceremonial or medicinal use of traditional tobacco by indigenous people. I try to say commercial tobacco all the time, but if I say tobacco, it is in the context of commercial tobacco. So I do plan to go through kind of how did we get here. I hate starting with data because data is a result of actions, and the actions in most of this case is the tobacco industry and the vaping industry, which is intertwined. I want to talk, how do we address this through a public health lens? And then what are we doing and what's available to make change? What resources are out there? I'm open to questions at any time. Angela said she'd monitor the chat, and I'll pause between sections to allow time for questions. So I got to start with who I am because these are my grandkids. And this is part of what energizes me to keep going is the fun we've had together and the knowledge they teach me. And one thing I often say to them is when we're playing together is, uh-oh, we've got a situation. It could be many games, but it's usually when we're working on some kind of Lego piece. And I have forgotten somewhere along the way to do the right piece in the right spot. And then I say, and they'll say, why do you say we have a situation, Grandma? And I'll say, because it's complicated. And then they smile and help me figure it out. But I think with a lot of our public health work, if you're like me, I want to fix things for people. I want to help and fix. And sometimes situations are complicated and there isn't just one answer. There are multiple answers. And sometimes that can be frustrating. So I'm going to say it's complicated. So what is an e-cigarette anyway? I'm going to talk a little bit about the kind of evolution of the devices and how they have become more effective, powerful, flavorful, and enjoyable for getting addicted to nicotine. Whoops. I want to remind us all that the tobacco industry, Brown and Williamson in 1963 said very clearly, nicotine is addictive. We're in the business of selling nicotine, an addictive drug. So I think we've got, I'm going to mute this. There we go. So don't forget that this is about profit. This is about corporations. This is about business, and it's about addiction. And we saw that really easily with the $9.5 billion of marketing a year that the tobacco industry spends on marketing their product across our country, much of which is targeted to youth. So I actually remember the first time I got a phone call from a public health worker. It was in the summer. It was about 15 or 20 years ago. It was a while. And she said, "What do you know about e-cigarettes, Pat?" And I had never heard of them. So I quickly made a couple phone calls, and people that I trusted as experts said to me, "Oh, we've heard of them. It's a fat. It's kind of nothing. This will go away." Well, they didn't go away. This was actually the first introduction was a booth at a rural county fair. They were selling e-cigarettes. And they did look like cigarettes, and that's why they're called e-cigarettes. They were originally developed in China. The original intent was to help people stop smoking. That soon changed very, very quickly. And you can see as years go by, they became larger. The mod you see in 2012 is kind of those devices that you add your own liquid. They have a bigger battery, they have a more powerful heating device, and get sometimes when you're behind the people that are using these devices, you might be behind them in a car and you see this billow of smoke or vapor coming out of their window. You think maybe something's on fire, but it's the volume of a vape cloud that those generate. And then they got smaller and smaller, and whoops, gotta go back, and more effective in their delivery systems. And I don't have 2024, but what I will tell you, you'll see this one on here has 5,000 puffs in it. That's what that reads on that slide. I was in a vape shop this summer with a colleague, and we were just inquisitive buyers and asked what one of those devices, how many puffs was in the one that had the most puffs. Remember, a puff is a puff of nicotine. And we bought the device because it had 30,000 puffs in it. 30,000. Uh, and then we'll see that these are really popular ones with youth. These are Loon is manufactured in Minnesota, very much producing, Elf Bar is. This changes from year to year, but just giving you an idea of what some of them look like. And then kind of some equivalents of how much nicotine are in these devices compared to a pack of cigarettes. And it doesn't take long to figure out that a young person is getting a boatload and more of nicotine in these devices. And I think back to when I was a kid, and most people that start smoking started smoking before they were 18. I did a lot of smoking cessation in my early years of working with the Lung Association. And oftentimes when I'd ask someone, how old were you when you first tried a cigarette? It would be 10, 11, 12, but none of them were telling me that they smoked a pack a day. It just was very hard to do. It's hard as an adult if you have to go outside, light up, hide in an alley. It was lunchtime at school, run back. Hopefully you don't smell like secondhand smoke, mouthwash, etc. But these devices are just, they're really beautiful, flavorful, easy to handle, easy to hide. They don't have a distinct odor because there are many, many thousands of different flavors, and they smell like other things. So very hard to detect. I think we're dealing with a level of addiction because of these devices that we've never experienced before. And then there are other nicotine products that are really growing quickly in popularity. And the one I'm showing two of them here, one Lucy and the one on Zyn, and I'm going to show you what they look like. Zyn has actually just taken off in popularity. They were so popular during this year that they ran out. There was a shortage of them, and the company that makes them, and it's a tobacco company, is building a new plant in Colorado just for Zyn products production. Okay. Okay, I'm going to skip this next slide. I'm going to show that one. I'm going to show you how much social media is a part of this. You may see, well, I never see any of this. I don't know about these products. But, a lesson about marketing is if you market to everyone, you market to no one. You really market to who you want to buy your product. So you'll see all the billions of views on social media for vape devices, and that they're targeted at children, and there's influencers involved. They're not targeted at most of us because we're not the audience that probably is going to take this up. I see that there's a hand up.
Hello, yes, this is Peggy, Miss Pat. You had mentioned something that you passed through it pretty fast, but that slide with is it you call it zinc or something? What was that?
Say it again.
Zinc something or start with a Z, I thought, but it was like the powder, the little
The
right there. What is
packets?
that?
Oh, that's the powder that's in the packet. That's a packet emptied out. And it's nicotine. It's nicotine that's in that powder.
You know they have these things my mama used to do for pain that she used to have BCs or something they used to call them, and they look just like kind of like that, but I've never saw or heard of this.
Well,
Okay.
if ask a young person. Sorry,
Okay,
I
for
just
sure. Okay,
yeah,
okay.
these are really popular. They're so easy to hide in your cheek and in your gum. Um, there's they're just so easy to hide, and they provide a powerful hit of nicotine, a real buzz. Yeah,
Wow. Okay,
yes.
thanks.
And TikTok, there's actually been studies on influencers and TikTok users says the more you watch these, the more you see of these, that you have a higher chance of using these devices.
Mm.
I guess my point in all of this is it didn't just happen. And again, there is concern about e-cigarettes and marijuana. I was talking with a school official yesterday and saying, yes, they see many THC vapes and combination vapes. Nicotine actually enhances the effects of THC, so they often go together. And we're about to, we've legalized recreational marijuana in our state cannabis, and I think we're going to see a whole new level of these devices delivering THC. So you might be asking, well, what are the health risks of these devices? And we do know some, we don't have decades long experience with use, but we do know we are learning a lot every year. So I wanted to show you that because as community health workers, you would know that this is an asthma inhaler, right? But it's actually a vaping device. This is how kind of outrageous the industry is about promoting um, this product. So there's not just water vapor in the devices. There are other chemicals, including nickel. There's a coil in the devices that's made out of nickel or lead, and that there are carcinogens within these devices. So it is not just as simple as water vapor. I want to show you this slide because to me, this is what changed the revolution around vaping. So we know that one of the things that's important about drug addiction and what makes a drug addictive is how fast it gets to the brain. The faster, the better. We know that people that wear nicotine patches a patch gets to the brain very slowly. It's like very slowly, like kind of like the average e-cigarette. It takes a long time. What makes cigarettes, the lighting of them and inhaling of them, is you inhale. The fastest way to get a drug is to inhale it. And it goes to the lungs, out to the blood, up to the brain in a matter of, minutes, not even that long, time to first puff. And Jewel discovered that the chemical formula of making it a salt-based liquid that the nicotine was in could replicate that delivery system. And so you see the average e-cigarette along the bottom of the chart here. That's pretty, it's going to be hard to get addicted to that because it takes a long time for it to go up. But when Juul came along with that salt base, it almost looks exactly like the delivery of a traditional combustible cigarette. And that is when things really got moving fast in kids' uptake of e-cigarettes. And in case you didn't know it, Juul actually was so appealing to the tobacco industry. And if you don't know who Altria is formerly, they own Philip Morris cigarettes, Marlboro's, the largest, most advertised cigarette in the world is Marlboro. And in December of 2018, Altria bought a little over a third of Juul. And it actually, you'll say there, Juul could become the Marlboro of vaping. And all the employees that year got huge bonuses because this was billions of dollars of a buyout. It was quite the event and quite the tell that this is the way the tobacco industry was headed. So I want to just show you, because sometimes oftentimes we'll say, it just got said to me yesterday by the school counselor, kind of like, when a kid is caught with drugs, this is what happens. And I'm saying, well, nicotine is a drug. So it activates the same pathway in the brain as other addictive drugs, and it actually enhances some of them. Nicotine, heroin, cocaine, alcohol, that same pathway is stimulated. And and it's concerning, especially with young people in a developing brain. I don't want us to forget that nicotine, it says tobacco, but it is the nicotine in the tobacco, is the drug that when people use it, like they're most likely to get addicted to. I mean, we've all heard people say when they quit alcohol, that was easy, and quitting nicotine was much harder for them. Okay, so addiction can happen really quickly, especially with youth. Think about those devices I showed you and how many hits of the drug they're getting a day, potentially a day. Very few of them are using a whole one in a day. But when you watch somebody that's vaping, next time you see somebody vaping and they're clutching it in their hand, watch how many times that goes up to their mouth for an inhalation. And think about, would they be doing that with a cigarette? It's pretty much constant. So addiction can happen pretty quickly. And I'm just showing you again that nicotine dependence of any product within, how do we know when people are addicted? Sorry. It's the key question. If you're wondering if a client says, I think I'm addicted, the question to ask is, how soon after you wake up do you reach for that product? And if they say it's the first thing or it's within 5 minutes, that is a key indicator of addiction. So you don't need a big test. All you have to ask is, how soon upon waking do you reach for that? I've had children say, teenagers say they sleep with their vape. I've had people that smoke tell me they get up at night to smoke. So it's a very powerful addiction. So what do some of the symptoms of withdrawal look like? And I especially, this is true for nicotine of vaping or smoking. There's a craving, they're anxious, depressed, drowsy, you see all that, having trouble concentrating, and you can imagine how this impacts a classroom. a young student that's trying to concentrate, their vape product has been confiscated, taken away. I'm not saying give it back to them, but they're in withdrawal. It looks like a lot of other behaviors also. And it could be very well be that they're struggling with nicotine withdrawal. It impacts learning, it impacts attention span. It has a lot of implications because young people's brains don't fully develop until age 25. Okay, I'm gonna say that same thing. The Minnesota Youth Tobacco Survey just last year said that about half of the students who are vaping report having very strong cravings, that they want to quit, they're trying to quit. Many of them have said they've made quit attempts of up to 10 times, but have been unable to quit. And so this is something I think we're learning how to address because, as I said earlier, we've never seen addiction to nicotine in children at the level we're seeing with these devices. So you should know, I'm going to tell you, if you didn't know, you should know that the American, whoops, I'm not going to tell you this one, has not approved NRT for adolescents. This is an old slide, I'm sorry, because they have now considered, given the effectiveness of NRT for adults, they are considering that they should be used for young people, especially those that are struggling with withdrawal. And then I want to talk a little bit about the mental health component with this. And looking at, this is also from the Minnesota Youth Tobacco Survey that was recently released. The overall number of 30% of students report some kind of symptoms of anxiety or depression. That's across all students. But the blue bars you see are those using vapes or cigarettes, cigars, or smokeless tobacco. So there's a level of self-medicating going on here. I also wonder if some of it isn't about dealing with addiction and feeling anxious when they're going into withdrawal from not having their vape device, or depression is feeling that I'm addicted and I've lost control, or all of the above. What we do know is that nicotine doesn't help anxiety or depression. I can't tell you how many adults have said to me that they smoke because it helps them relax. They smoke because it helps with the stress. And then what it does, I would agree, because they're in withdrawal. Okay. It's not because a person that's not addicted to nicotine would say, oh, I'm really stressed, and someone would say, here, have a cigarette, it'll help you relax. The reason it helps gives people that relaxation and that sense of relief is because they're in withdrawal. Immediate gratification, and there are long-term detrimental effects, the addictive properties, etc., and the lack of focus if long periods between use. I put this older slide in because when I first saw it, I was so moved by it, and I've shown it across the last 5 years to people because I think it's such an important slide from the student survey that was done in 2019. But these are students who used tobacco in the last 30 days by their mental health indicator. And you will see that, I'll say to somebody, if someone's telling you they're vaping, a young person, you really need to ask about anxiety and depression, about suicide ideation, or suicide attempts. There clearly is a correlation there of the use and the mental health. All right, so what else can happen that we know? I know popcorn lung, you've heard of that. I think it came up long ago to chemicals that were added to microwave popcorn, and workers in the plant that was manufacturing the popcorn started to get little holes in their lung from this chemical, and it was banned. So have been a few chemicals that have been used in early vape products that have been banned, the flavorings. But right before the pandemic, I hope you remember about something called EVOLI. The E should be there. It is e-cigarette vaping associated lung injury. And in the first state to report an EVOLI case was Wisconsin. And I think Illinois was second and Minnesota was third. It was late in 2019, and the CDC was tracking it because it was so profoundly debilitating to young people. Minnesota had 149 confirmed cases of EVOLI, remember, e-cigarette or vaping associated lung injury, and 3 confirmed deaths. And as the CDC did their great work of detecting what was the common denominator, it was the liquid that was in the device that contained vitamin E acetate and THC. That was the common denominator in most of the products. And I do know there was a young man in South Dakota that actually ended up with a double lung transplant from vaping a very short time. This isn't a lifetime of vaping. Okay, other health consequences, if you don't care about the lungs, we rarely hear this one, but those sweetened devices, that liquid in them, have a really nasty impact on dental and oral health. And it's worse than you think, and I just think that's so gross. So what do we know? I'm going to stop right now and just say, any questions from here?
I don't see any in the chat so far.
Okay, I don't want to like go so fast people don't get it.
This is a lot of information.
It's stunning, isn't it?
It really is.
Yeah.
And just, I guess, it's just things that we don't, just because you're the professional now, I never thought of or realized. I knew it was bad, but wow, it's just overwhelming.
It is. So, I don't want to overwhelm anyone because I'm about empowerment and about change. I'm a policy person, and I do have some, it gets better. It gets better.
Okay,
But
okay.
but my whole theory about change is first you have to educate people about what's going on. So think of this in your own profession. You're educating your patients, your clients about what's going on if they have a problem. And then you want to motivate them that there's something that they can do to change it, and then activate them and support them in making that change. So that's how I'm rolling, and that's what we'll get in the next few slides. All right, so here's the numbers nationally. There's a lot of youth. I guess the good news is that the rate of combustibles of smoking cigarettes has gone down, and some e-cigarette use has gone down in high school students, but I'm very concerned about those middle school numbers, that it actually went up almost 50%. And here's more what kinds they're using. 9 out of 10 are using flavored e-cigarettes. That's the key to change, is getting these products off the market. So flavors hook kids. It's very clear, and the tobacco industry knows it, and they're using it because flavors sells nicotine, and nicotine keeps them customers. Remember the first couple slides. It's about the nicotine. So here's what kids in Minnesota told us when they first used a tobacco product, and most of these were e-cigarette users. They used flavors. Very few of them chose tobacco flavored or unflavored. Where do they get them from? Well, a lot of people think they're getting them off the internet. I think that was way down at number 4 here is the internet, 4%. They're getting them from friends. They're getting them from friends. They buy them in a vape shop or a convenience store, a little on the internet, or some actually report getting them from their parents. Because if a parent says, well, at least they're not smoking, my answer would be, but they're not breathing clean air. How students who currently are using got their e-cigarettes, someone offered them to them. Many times youth report that they were in a group and they were offered kind of what they call is the group. It's a, you know, that those devices have a lot of puffs in them and they cost maybe between $25, $35, $40. So if everyone pitches in a $5 bill, everyone can take a puff off the community vape. And I, you know what all that germs is all about. I'm only talking about the nicotine. To get other people to buy them. Again, it's how are they getting them? And I do want to say it doesn't discriminate. I think we have stereotypes of who is most vulnerable to take up smoking. You know, the biggest factor would be poverty. But for vaping, it's athletes, it's honor society students, it's rich kids, it's poor kids. It is across the spectrum, across it. So what can we do? Throw up our hands. Remember, it's a situation and it's complicated. So I want to say for sure, we want to look at this issue from a public health lens about support and not punishment for the target. You know, my punishment would be for the industry and not for the child who got involved with this. So I really, really emphasize that. I also want to talk about how I'm trying to reframe language about these products and about our work. That I like to use person first or person centered. It's not a smoker, it's a person who smokes. I don't know how to say a person who vapes, not a vapor, but I would say a person who vapes. It's that they have a tobacco use disorder and that vaping is about nicotine dependency, that we talk about it in the framework that we do for substance use, that they may not be ready to quit, but they're ready for treatment. That it's not just a habit. When I first started work for the Lung Association, we had a slogan that said, kick the habit. And that we, to get rid of that awful word cessation, cessation, it's treatment and nicotine dependency treatment. And the triangle for treatment is medications, counseling, and support. And that includes for youth. And when the student health survey in Minnesota asked kids about their quit attempts, their attempts to stop, none of them reported medications that they used. The vast majority made, I'll just do this on my own. And that is very difficult to do. So you know these, I hope, that they're the ask, advise, assess, assist, arrange. I like to say ask, advise, assess, assist, and arrange to help with them. Because who could be one of the most trusted people in families and children's lives is a community health worker. So for sure, ask and listen, and then advise and assess. You know. That we want to talk about what the patient's readiness is, where they're at. Are you ready to quit? They're not. There's many youth that say someday, but not today. So what are you ready to do? What do they see the risk of using? They may not think these things are harmful at all. What are the rewards that they see in changing? They may not see any yet, but a good way to ask the question on a 1 to 10, where are you? And 10 is, I've stopped using this. And maybe they'll say I'm a solid 2. And that's great. And then the question is, what would get you to 3? And take it one step at a time rather than I'm a 2. Okay, we need you to be a 10. Let's set a quit date. They're not there. We got to I say meet them where you're at, hold their hand and move them along. And this is that Fagerstrom test about, it really is that first test is how do you assess the addiction? How soon upon waking? That's the key question. Do you smoke or vape? We've got a similar one for vaping in our resources that I'll show you. Is it difficult for you to refrain from this? Which would you hate the most to give up? You don't want to start with those. You want to start with the easiest to give up. And how much are you using? So that's the one-on-one. When I talk about these interventions, this is the individual approach, one at a time. We're doing one at a time, slow but sure. Now I'm going to talk about policy interventions, which is that old story about, you see someone drowning in the river and you jump in and then down comes another, and pretty soon you're exhausted and we got to walk upstream and fix the broken dam in the river. So that's what I think of as policy interventions. We're fixing the dam. And one thing we did when we're in our Lung Mind Alliance effort, and I know some of you have heard about this, is our partners that are providing services to those with experiencing mental illness and or substance use disorders said, we want to treat for nicotine dependency, but we need to be reimbursed. And we've heard that for a long time. So 2 years ago, not last session, but the session before, we actually passed a bill that expanded the types of providers that could be reimbursed for tobacco treatment. And there's the list of how it was expanded. And we also removed the barriers to the FDA approved medications for tobacco treatment or nicotine dependency treatment. And there's no cost, there's no barriers. So if a client was using, let's say, a product, I want to say the inhaler, but I know that they've been off the market for a while because of supply chain, but the inhaler, which is a prescription, and wanted to get that from their insurance, they would have to, in the past, they would have had to try the gum and the patch and this and that step process. This bill took that away and just said, if that's what they want to use and however much they need to use, we're not, there weren't limits on the treatment for nicotine addiction. But I will say to you that the bill was supposed to go into effect January 1st, 2024, which is now almost a year ago. And we've been working with DHS to just get through the details of how do we get to billing codes. And we're not there even yet. And I was saying earlier, when we get to the community health workers and the questions that need to be answered about certification and criteria and scope of work, we definitely want to engage you community health workers in that conversation. We're not there yet, but we know where you are and you know where we are. So I do want to say last year, Minnesota passed a deceptive vapor law. And I'm going to tell you a little about it because it's a law that I say the American Lung Association and our coalition we belong to, the Minnesotans for a Smoke-Free Generation, really didn't voice any kind of support or against this law. It happened by a well-intended lawmaker, and it turned out to be a kind of a better law than we thought. This is the language of the law, but this was to try to get some of those egregious kid flavors off the market. And so you'll see it's they can't be called a food brand commonly marketed to minors, but not limited to candy, desserts, and beverages. And I'll show you some examples. They can't look like school supplies, erasers, highlighters, or pens, or an inhaler. And I love numbers, Roman numeral 3 there are the 3 dots of the eye. It's a product based on or depicting a character, personality, symbol known to appeal to minors, including celebrity, a comic book character, a movie, a TV show, a video game, or a mythical creature. Because there are many flavors that are unicorn flavors. And that's why the mythical creature came in there. So our Attorney General held a press conference this year. Remember, this is what can we do? Big picture to fix the dam. And Attorney General Ellis held a press conference. This was the Friday before Labor Day, that he was sending letters to 5,000 tobacco retailer businesses, including vape shops, because they're licensed as tobacco retailers, telling them about the law and also about the FDA rules about products. And he asked them to sign on to say they would agree to comply, you'll see, and ask the businesses to certify they would comply with the law. And these were all the boxes of letters he was mailing out. Well, I know you can't, well, maybe you can, if you have a big screen like that. These, in reality, the only vape products that have been authorized for sale in the United States by the Food and Drug Administration are these products. There's less than 30 of them. All the other flavors I showed you have not been authorized for sale and are illegal. But the market got inundated and the FDA does not have the capacity to enforce the law. And so it's the Wild West. But these are the only pre-authorized products. And you'll notice they're all tobacco companies that got approved. RJ Reynolds, you know, Enjoy, it's a tobacco company owned. Logitech, same thing. So these are the flavors. This is right from the Attorney General's press conference. These would be illegal products in Minnesota. Cookies and cream, marketed to kids. Banana, he said creme brulee. These are illegal products. I didn't say it, the Attorney General did. These are products that fall in that category of looking like school supplies. Yes, that highlighter is really a vape. And I had a public health nurse tell me she knows exactly the store in her community that is selling those, and that she went to law enforcement and they said they wouldn't enforce the law. Yeah. And this newer things that are out there, guys, this is a video game on a vape device. See the buttons there? You can play a video game on your vape device. And yesterday, one of my staff was telling me you can actually Bluetooth some of the vape devices and play Spotify on it. It's out of control. So if something you can do is really, the Attorney General's office is taking complaints. So if you see these products in your neighborhood, you can email them or you can file a formal complaint, and this is how you do it. And this is kind of how the law works when it comes to public health. You know, the state of Minnesota sued Juul and won $60 million in a settlement. The year before last. So this is how we do it. And this is a role that you can take if you're going into vape shops or if you're going into your convenience store and taking a look around. Remember, there's only about 27 products that have been approved. None of them are flavored. There's 2 menthol products. The rest are tobacco flavored. There's no cherry flavored, banana flavored, maple, none of that. Those are illegal. And then I do want to talk about punitive versus educational. You know, we're doing a lot of work with schools because they are really taking the brunt of this epidemic. And I feel really strongly that we want to assure that they're looking at them from a public health lens and not a criminal justice, that children aren't be given tickets for
I have a class going on, so this is about.
whoops. Okay.
I need a nighttime.
Okay.
I
Somebody
have water. I have
can somebody mute their
have fruit, yes, and water. Well, you don't eat dinner? Not nighttime. Oh, yes,
Sorry.
after like 5 or something. Yeah, I don't.
Angela, are you able to mute folks? I was gonna ask.
Is that my break?
Okay.
Cool.
So
Is that your own hair? No.
sorry,
Oh,
guys.
that's all right. You do you and do it the way you want, right?
Okay, we need somebody to mute,
On
and
the
I think
south
it's
side.
Kim.
Good.
I'm not sure. No, Kim's muted. So got it. All right.
Oh, I gotta put it over. Thank you. There you
Maybe
go.
it's-
You can use it now.
It's Liz Reller.
Don't say that.
Yep.
It's
We need you to.
Rat fasting, Ramadan. Yes, that's in January though,
Yeah.
isn't it?
Okay,
A
guys,
birthday.
I don't know about you, but this is, um, okay, I muted her. Got it. I did it. Uh, so punitive action versus education, that there needs to be consequences, but they should not be criminal consequences. That we really want to work hard to keep youth in school. I think I heard earlier this year before school started, I was doing an in-service, and one of the counselors told me she was working with a student that was suspended 12 times last school year. And that's a big hurdle to overcome to stay into school. So we really want to think about consequences that are not criminal. And there is a model policy for schools to adopt around tobacco-free and use of vape products in school. I also want to mention to you that vape products are not to go into the trash or recycling, that these, I want to use air quotes, disposables actually contain lithium batteries in them. And when they are crushed, they can be fire hazards, and the liquid in them is a toxic waste. So each county handles the disposal of these differently, but you should know that these aren't things you just throw in the trash. And I wanted to point this one out because this is the sewer outside of middle school by my house. And our environmental services folks said the sewer got clogged, and these are all the vape products that students had flushed down the toilet. So, okay, resources for you. The American Lung Association, if you just go to lung.org, has a lot of resources, but I'm also going to send Angela an electronic copy of the resource sheets we've put together, and I'm going to show you what they look like next. So we've categorized them because there are a number out there, and I'm all about promoting whatever meets your need the best. If it's a lung association program, great. If it's not, that's great too. But these are community education resources for parents and caregivers. And I think they're really important because schools will say to me, well, the parents don't really understand that these things are dangerous or a hazard. What can we do to educate them? And to educate our communities about how we can regulate vape shops and these devices. These are resources for treatment. I want to just say treatment, not cessation, but these are focused on youth. Some are focused on adults. And it will say these are youth ones here, Quit Partners for Adults, Quit Line, Truth Campaign is a texting. It says what it is. These are all free. And I want to point out these because I mentioned the American Academy of Pediatrics, but they have really good information for parents. They have a toolkit. And then this one is the nicotine index. This is that Fagerstrom one I did about smoking, the questions on are you addicted? This is one developed for young people on vaping from Penn State, is in that also. And then I just want to highlight the free ones from the Minnesota Department of Health and the Quit Line. I don't know if you know that, there's also a Quit Line that is culturally tailored for the American Indian population. There is actually one for behavior health clients also that you can get nicotine replacement, the patch gum or lozenge, free of charge. So all underutilized and something that this could be a referral on that Ask Advice Refer. And then finally, I want to say thank you before I open up for questions. This is my sister. She's no longer with us, but social workers and community health workers were a big part of what made her life really it just made her life possible. She was developmentally disabled. I was her guardian, but she's the reason I'm the advocate I am. And I always want to remember her and thank her for her tenacity because she never wanted to be limited. She wanted to do as much as possible. I feel like that spirit is within us and as we move forward. So thanks to my sister Sue, and then questions.
Thank you so much. And we can open up the session for questions. So feel free to come off mute and ask any questions that you would like answered, or pop them in your questions in the chat.
McDolly is asking, will you be sending us a copy of that PowerPoint?
I will gladly send you a copy of the PowerPoint. It will be in a PDF form because it's really big. And yes, I'm happy to send that to you.
Thank you.
Are there any other questions in the meeting?
I found it really interesting to learn about that inhaler that you showed, that I was so shocked to learn that that was a vape.
Oh, I should tell you, there's also a
I
watch.
mean, I have asthma myself and I use an inhaler. So when I saw that, my mind was blown from that.
Yeah, it should be. I mean, we should be outraged. There's also a smartwatch that's a vape that you take off, it pops off and then you inhale on it. I mean, just think about a teacher or a school person trying to chase down these things. I have to tell you, the schools are exhausted from this, and they're exhausted. They've done all they can do, and these are well-intentioned folks. It's so pervasive. So
And what
I
kind of
would
companies
tell
are
you,
making those products? Are those the same ones like the tobacco companies making those sorts of products like the watch you mentioned?
they aren't, but all roads eventually lead to the industry. I just it's just too sophisticated for it all. So I say all roads lead back to greed or corporate greed. And I mean, think about it. Who could sell a product that used as director kills half of their customers? And they
Absolutely.
knew it long before we did.
Mhm.
Yeah, they're murdering millions of people just, for the money.
And I'm born and raised on the Iron Range, and I would say, and we're used of it, because we pulled carrots a couple weeks ago because there was a salmonella or something. We pulled carrots. We didn't care about that farmer losing millions or hundreds of dollars, thousands of dollars. We pulled McDonald's quarter pounders because of the onions. But when we say we want to pull these flavored products off the market, everyone goes, oh, you can't do that. That's, people have a choice, and just that independent streak gets in us, and we don't see that these are loved ones that are dying. It's not usually a quick death. It's COPD, it's lung cancer, it's heart disease, and
Slow, costly deaths. Very, very expensive,
very costly
very
in
costly.
so many ways. Yes.
So many ways on the individual, their communities, their peers, their families,
Yes.
all those
Yes.
connected to those individuals. I myself have a sister that has COPD. She's still with us. She's oxygen dependent, and have been for a few years. But that was one of the things that she inherited from smoking and being an asthmatic all of her life. I'm so grateful. I was a smoker until my first granddaughter was born 17 years ago, and I said I didn't want another child to be born in my family to even know that I even smoked at that point in time. And so that was my motivator, and I never looked back. And so I'm so
for you.
grateful for that in my health outcome. But I contributed that with, I look in my family and those that are those are there of us that are in like healthcare, in public service, health service, and health settings. Our health is a little bit better than those in our family that's not. So knowledge is truly key, and I appreciate you bringing this knowledge to the CHW Learning Circle, and including CHWs in that conversation. So yeah, Miss Peggy said that while it was some great information, she learned so much. And so CHWs are constantly uh, wanting to figure out ways to learn and expand our knowledge and our skill set so we can take that back to the communities that we serve and help encounter those things. But this is a really creative, this you said smart watches and inhaler looking items. Like I never even
I
fancied
can't
those
believe
type of
it.
items being on the market, but now I'm more aware. So
And that's what's so amazing. We really appreciate you, Miss Pat, because I guess I just didn't have a clue. But when you're not really in that environment, and I can't imagine what the teachers are going through. Wow. And to see even for the music and to have their games, because you know how they are, and to have that tied into that,
Yep.
oh, seems so cool.
Yes.
Those are lifelong customers and lifelong patients, potential patients. Yeah.
It's all
And
about the greed and the dollar bill.
yeah, dollar. So I would just say you might also get people asking you about vaping oils. What do they call essential oils?
Mm.
That's also, well, just Google it, ladies and gentlemen. You'll
Yeah, I'm gonna have to. I keep
and I was talking with a mom whose eighth grader was vaping, and she was kind of it was a very civil conversation. And she said, you know, the positive for her daughter is the social accepting, feeling like she's belonging to the group, which belonging so important, right?
Yeah.
yeah.
And I said, she said to me, well, what if she vapes the essential oils? And I said, I've worked for a long time. I've never had a pulmonary doctor say your lungs need to get oiled. They just
Yeah.
don't.
Just
So
imagine.
no, what
Yeah.
about, what about not doing it or just using a device that's fake, that has nothing in it, an empty one? And so
Yeah.
it's just, so essential oils, yes. Your lungs don't need oil.
Mhm.
They don't. They need clean air. That's what they're built for.
Absolutely. Wow. So much to consider for us. So a lot of things to process. So thank you for this information. We are at the 40 we're
Yep.
at 401, and so we're at the top of the hour and we can shift into alliance business. Ms. Pat, thank you so very much for ending and closing out the year with us. Happy holidays. Look forward to any follow-up information from you. Would definitely like to connect with you to expand some further conversations.
Great. Thank you. Thank you.
Yeah. Um, Well, thank you everyone for coming. That was a lot of interesting information. I prior to my role, I was a tobacco treatment specialist when I was employed through um uh People Incorporated Mental Health Services. So I operate in a dual capacity as a CHW, providing CHW services, but also tobacco treatment services. So there are some mechanisms that CHWs can receive trainings through their employers or through various other entities that can become a tobacco training treatment specialist and provide those services that have a potential billing structure to them. Now, how they're constructed, I don't know. That is something that I would like to look more further into as I approach to renew my tobacco treatment certificate. So I will make that information available once I know more, or I'll follow up with Miss Pat as things develop. If she has any resources, and definitely share it out to the CHW community. I popped in the chat at the end. We're ending the year, and I always like to encourage individuals to send topic ideas or reflect back over the year and what you have learned with the learning circle. So I have created a survey and popped it into the chat. If you could please just it shouldn't be no more than 3 minutes to just share your experiences of the 2024 learning circle. That is really important to the learning circle because the learning circle really doesn't have a yearly budget. And so we utilize your feedback and these surveys to petition for grants and funding to be able to have this platform. And so your thoughts and feedback is very important to us as well as we build out content for 2025. We don't want to just bring you something and say, here, learn this and learn that. We want your voice and input with that. Generally, I have an intern that helps and works around. That's their assignment to figure out the topics for the year. But I'm independently doing it now until some of the trainees have transitioned into the space where they could become interns, and then I'll start vetting for an intern myself. So if anyone has some clerical, corporate, administrative skills, please let me know. These students on here are versed in social media platforms or administrative tasks. Please let me know. I'll be looking for an intern coming in the beginning of the year. Our next session for this will be our last session for the Learning Circle for 2024. So we'll close out together. So I want to wish everyone a warm ending of the year. Take time for yourself and family to refresh and get yourself charged up for 2025. Our January session will be Wednesday, January 8th. We won't do it on the first Wednesday because that's a holiday week. And we don't want to infringe on anyone's holiday. So we're going to resume on January 8th at the same time on Wednesdays at from 3 to 4:30 p.m. And then we're going to have American Cancer Society kick off the year with us. So again, please fill out the survey. We want your input as we start planning. It also gives my students something to learn and research and build their skills on how to put together a platform such as this, because one day I got to pass the baton on. Um, so I'm always looking for individuals that are interested in doing this type of work. I don't have a lot of our legislative action committee has resumed our bi-monthly meetings, and so our first meeting was on Tuesday, December 3rd. Our next meeting will be coming up on December 17th. And so I've been in that space representing CHWs, but if we have anyone on the call that are interested in legislation priorities and policies and billing reimbursement, please reach out to me and we can have those conversations. It's not as intimidating as you think. I was kind of say, hey, check it out and see when I transitioned into my role as AD. And when I first was in that space, I didn't really know where my voice was, but over time, it's a very welcoming space. And over time, you figure out your niche, what you're good at, and so how you could contribute to that space, because that space is a space of advocacy and awareness and policy reform for our workforce. So it's helping us sustain and build our workforce. So we need CHW's voices there. We is nothing about us without us. And so being in those spaces, we should be in those rooms, in those spaces. So an open invitation to those that would like to do that. I'm also formulating a new CHW advocacy advisory committee. And so I feel like that would catapult CHWs to the forefront and empower CHWs around legislation and advocacy and various things like that, to give you that grassroots education, so you won't feel like you've been thrust into a situation and it's like a sink or swim. And so that would be a peer-to-peer space for just CHWs. We are planning to launch that in January 2025. Another announcement you may have saw in our newsletter is our CHW Leadership Institute. That is a robust leadership training for CHWs. I'm a two-time overgraduate by choice. And then I came back and I co-facilitated 1 year of the CHW Institute. That was prior to COVID. So we will be resuming that again for CHW. So the instructions on how to apply is in our newsletter, and you can also find it on our webpage. If you're not signed up for our newsletter, please sign up for our newsletter, as well as our social media alerts. We have YouTube stations and various ways for you to connect with the Alliance. We value you. We appreciate you spending your year with us. Please reach out to me if you have any questions or suggestions, or if you just like to chat. So again, I'm going to remind those that are on the call, please fill out the survey, and I will be also following up the emails out after the post meeting, the survey as well. So you'll get a chance to enter your feedback there. Do we have any questions? Comments, suggestions?
Thanks, Angela, for all you do. I would just like to say, as an organization, just the Alliance as a whole, so much great information. And we just got to keep on staying engaged and just keep doing it, keep plugging, regardless of who shows up and who doesn't.
Absolutely.
And I'm speaking to myself. So and because we just got to keep going, because there's some great work out there, and we need to share it. And I look forward to figuring out how that I can figure out a way to make it so that even as North Point as a whole, there's a lot of programs we're doing. There's no reason why we should not be doing facilitating to some extent. And that's something that we're working on, and we're going to definitely have to start doing that so that we can continue to learn from each other and grow,
Absolutely.
Yeah.
Definitely. So I'm totally looking forward to that. And if ever North Point wants to present at the circle,
And that's what I'm saying. We just have to,
so we can
and we
learn
need to get engaged. This is our work. This is
Yeah.
what we do, and we learn from each other. So, and we definitely gonna do that. I'm just a matter of me getting the crew together. It's not just about one person. It's about us as a
Absolutely.
whole. And that's what I'm learning, is that, it ain't about what all I can do. It's what we all can do as a whole.
It's
So
your team.
I look forward to that, because there is so much to share.
Absolutely, absolutely. Definitely so. And that's a good way to expand your acknowledgement of the programs and services. So you never
Yeah.
know, it could increase referrals. It could increase the
That-
demand for CHW services.
Yes, and that's what I know that to be true. I know
Yep.
that to be true. It's just getting on board, all of us just working together. So that's something as a team we're working on.
Absolutely.
So
Appreciate
now
that.
2025, it's time to get rolling.
Definitely so. Definitely so. So yeah, that's that I we're oh we finished at 4:12. Um
Okay.
is there if there's any comments or suggestions, questions, please come off mic and ask them now. Or you can pop them in the chat. Um we loved having you here with us today. It's like, oh my gosh, another year is closing out, like literally. And new beginnings are on the horizon. Oh, I see a little message. You are very welcome. Thank you, everyone. Thank you. Until next year. I think we have the AI left.
Bye bye, bye bye.
Bye-bye. Take care.
Till next year.
Next year. See you next year.
All right, ma'am. Bye.
Bye.
It's still recording?
Yeah, I'm closing it out now.
Okay.
I'm gonna stop the recording. And yeah. They updated Zoom and I have to figure
Girl,
out.
I'm looking at this. I'm feeling the same way, just like you. I'm like, where is everything at? I'm like, I can't even see how to just exit.
Oh, it's a door. It's either an X at the bottom to your right or it's a
Oh, the
little,
door, the leave. Girl, I ain't never seen that.
yeah.
I'm gone. Bye.
All right, bye-bye. Take care.